I now get to pass it over to Olga Lucia Torres, who is going to guide us through an interactive session on listening as a tool to achieving health equity.
Hi, everybody. I am so excited to be here today. What huge shoes to speak after, and what a fantastic conversation. So I get to talk to you about listening as a tool to achieve health justice, in particular narrative medicine. I like to, you'll understand in a second why, but I need a roadmap so I understand what is happening and what is coming. So I'm going to share one with you. I'm going to quickly, very briefly share my story and how it ties to narrative medicine, in essence, how I found it. I'm going to talk to you briefly again about what is narrative medicine and how the tools of listening and close reading can be used as tools for health justice. And then the exciting part, which is we're going to have an interactive session. I've been able on a separate, I stole my daughter's computer to look at the chat. So that's been, I'm so excited to see how interactive you've been. I'm going to ask that everything that you've been putting in the chat, you raise your hand. The wonderful technical people running the summit have given me the go ahead so that they can unmute you, and we could do look at some art, some poetry, and we do some close reading and attentive listening together. So I was a very busy but happy public defender in the Bronx, managing multiple chronic illnesses. And because I like to keep it sexy and interesting, I have a pituitary adenoma, a benign tumor, and it gave me a number of hormone imbalances. But what it also gave me was diabetes insipidus, the opposite of diabetes mellitus. So my sugar tended to run low. Not a problem unless I caught food poisoning, which I did one hot August. And I got very, very sick. I had to go see my doctor. And when my labs came back, I got a call saying you have to be hospitalized because your sodium and your potassium are so low that you could have a heart attack. And I said some choice words that I don't think I'm allowed to say here, but basically I said, I guess I'll go to the hospital, but listen, I'm in between trials. How long will I have to be there? They said no more than 3 days. I get to the hospital and I was told 3 things. We recommend a PICC line because you don't have a viable vein for us to put an IV in. We recommend hypertonic IV. It has 3 times the amount of sodium than a normal bag of IV, but it will allow us to increase your sodium more quickly. And number 3, we'll have to draw your blood every 3 to 4 hours. It's inconvenient because when you're sleeping at night, we'll have to come in and draw your blood. But this is necessary because we can't overcorrect your sodium too quickly. That's very dangerous. I said yes to all 3. Again, I have a trial. I have to go to Rikers. I have, investigations. You get the picture. At this time, I had been managing my mother's blood cancer, fighting her health insurance tooth and nail to get her, it seemed like aspirin covered, right? No news to anybody here. And I had also been taking care of my father in Puerto Rico, who had Alzheimer's. Again, anything that they prescribed was denied. We had to do appeals at every level. I'm in the hospital waiting for my blood to be drawn every 4 hours, and 8 hours passed, 12 hours passed, 24 hours passed. And guess what? My blood hadn't been drawn. I used my little handy dandy call button on my bed, on my hospital bed. And they came to say it was August, they were understaffed, and they would get to drawing my blood when they could. My family friends went to the nurses station. They were told the same message. By the time I got medical attention, I was in a coma. My brain had swelled, and I had lost the myelin in a third of my brain. Again, for the medical professionals in the house, instead of central pontine myelinosis, I experienced extrapontine myelinosis, losing the myelin in a third of my brain. Myelin is the protective sheath around nerves. When they told my mother, and she had to call my father to say that I was dying. Well, I'm still here, obviously. It took 6 years of inpatient and outpatient rehabilitation to recover, in large part because when I came to and was told what happened, again, none of it made any sense, but I said, oh, I'm not going to any rehab because medical professionals will have to treat me, and I don't trust them, not even to say hi, because I'm sure they're lying to me when they say hi back. My trust was entirely broken with the medical, with the doctors, with the healthcare system. But I had no choice. I had to recover, right? So off to the inpatient rehabilitation center I went, and they said, oh, ma'am, you don't have coverage. And I said, what are you talking about? I've been working as an attorney my whole legal career. They said, right, they're saying they're not going to cover you because they want the hospital to cover you. Well, then now I had to I had to go into an actual lawsuit with my health insurance coverage. Provider. It took 1 entire year for that lawsuit to be resolved. Here I am with aphasia, facial drooping. I can't walk. I'm in a wheelchair. You could see why I didn't know football at the time, but like I had a Heisman pose with the medical professionals. I did win the lawsuit. I finally started rehabilitation, but my mother died a year later. I took a pause. My father died another year later. So I had absolutely no trust with the healthcare system, but I slowly started recovering. And when I finally finished, I started doing health law. But what I found is by the time I could help my any of my clients, they were often too sick because understandably, they did not want to incur debt. Often in the hundreds of thousands, I had a couple of clients that had $1 million plus in medical debt. And so they were too sick or had died by the time I could call and give the good news to the family. That entered narrative medicine. A good friend had read an article about it, and off to Columbia I went. So what is narrative medicine? So one of the main goals of narrative medicine is to improve patient care for all through education, empathy, and storytelling. At its heart, it seeks to hone the skill of listening. When I met Dr. Sharon and she interviewed me for the master's, I said with my arms crossed, I don't trust doctors. I'm learning to trust doctors, but anytime they prescribe something, I go, no, I don't want to take it. And she said, I understand, but we need more patients to become narrative medicine practitioners because we need your perspective, and we need you to also become the teachers of clinicians, of medical providers, nurses, of all of the people that interact with patients. So I think she does a really great explanation of, in this quote, narrative medicine began as a rigorous, it's blocked here. I think it says, rigorous and intellectual clinical discipline to fortify, heal, it's to fortify healthcare with the capacity to skillfully receive the accounts persons give of themselves, to recognize, absorb, interpret, and be moved to action by the stories of others. And when I was practicing law, right, I got up, I did many trials. The prosecution got to go first, and they said one version of my client's story, right? They painted them as this monolithic bad people. But I got to go up and flesh out who they were, right? They were members of the community. They had families, they had mothers and wives and what have you, right? So we are natural narrative beings. We make sense of our world, our surroundings, and what happens to us by telling stories. And that should also happen in the medical encounter. The provider listens to the patient's story, either through our own voice, our interpreters, or whoever comes with us. And training, the narrative medicine training benefits both the practitioner and the patient by fostering communication skills and empathy, and by enabling us, the patients, because my perspective in narrative medicine is I'm always wearing my patient hat, is to be active narrators of our medical stories. Again, this is Dr. Sharon. Oh, I didn't explain. Dr. Sharon is one of the founders of narrative medicine at Columbia University back in 1996. Teaching clinicians the skills of the close reading and the close reading of literature, creative writing, and the viewing of fine arts can strengthen their habits of close listening or slow looking, thereby improving their quality of perceptive listening. And so what happens in a narrative medicine workshop? And we're going to get to do together the first half of a narrative medicine workshop. Is in the first part, we as collectively do a close reading of a text. It could be a poem, an excerpt of a short story, or even a novel, or a work of art. Really, the possibilities are endless. We could use a video, photograph, you get the picture. And we talk about it, right? We point out what we each notice, what stands out to us. And then in the second part, we write to a writing prompt in the shadow of the text. And then if we have brave participants, which I'm sure you all would be, we share what we wrote, but only what's on the page. We don't become, as I would say in Spanish, bochincheros, gossipers, and say, Gwen, I want to know more about what you wrote. We only talk about what's on the text. And we do that because literature and other arts provide an exceptional framework for observation and reflection on the complexity of intra and intersubject human relationships. We can notice the nuances and influences of context, circumstances, and characters. One discovers how emotions and words interact in the relationships between characters, narrator and reader, and individuals and society. So I want to share two of my favorite patient authors that I just really impacted me when I was getting my master's, and I teach now that I'm faculty at Columbia University. I get to teach narrative medicine. Really, something I never foresaw, and I thoroughly enjoy it because I get to work with many medical providers, but I also work with authors and journalists, and the patients, my students run the gamut. But Elaine Scarry, in her phenomenal book, The Body in Pain, and she wrote, physical pain does not simply resist language, but actively destroys it, bringing about an immediate reversion to a state anterior to language, to the sounds and cries a human being makes before language is learned. She also wrote that, she also said later in that chapter, when you have pain, you are sure what the reality of this pain is. But for the person you are describing the pain to, that hearing about pain may exist as the primary model of what it is to have doubts. And for me, that really spoke to why it was that I wanted to do narrative medicine, because I didn't want to represent one client at a time, but this resonated so strongly with me. And Anatole Broyard, also an author and literary critic, wrote in his book, Intoxicated by My Illness, to a typical physician, my illness is a routine incident in his rounds, while for me, it's the crisis of my life. I would feel better if I had a doctor who at least perceived this incongruity. And a couple pages later, he writes, I would also like a doctor who enjoyed me. I want to be a good story for him, to give him some of my art in exchange for his. And again, I just think we all want to be a good doctor. A good story for our doctors, but not if they're not even making eye contact with us, standing up while we're sitting, right? All the things that we know make for a bad medical encounter. So I finished my master's, I'm doing my work, and I realize there's a bridge that I have been unwilling to cross to meet clinicians. I'm over here still with my arm crossed, doing the very thing that I am accusing clinicians to do because, as Ms. Head just said, I don't trust. When I was admitted when my brain injury happened, in my check-in, where they ask you what medicines are your medical history, I'm speaking Spanish with my mother, my native language. And a nurse said to me, "This is America, you should speak English." And everything intuitively in me said, I need to bounce. I should leave. My mother said, "You should tell her you were the first one in the family to go to college, to go to law school." And I said, I shouldn't have to pull out my resume or my CV to get good medical care. I should get good medical care. But now I was willing to cross that bridge and go and explore, how do we start working with, like Ms. Head said, how do we start moving towards those skills that we need to work with medical providers. And for me, it's narrative medicine. So the 3 tenets of narrative medicine are attention, representation, and affiliation. Attention, and these are all very intuitive, right? It means to selflessly focus on the patient or the other, right? And the type of listening we're talking about, you've heard the terms, it's radical listening or attentive listening, and it includes close reading, observation. Representation is to witness and record what happens in the encounter. We call it co-creating the story, right? It invites reflective expression to allow for identity formation. Affiliation is to garner enough trust to create better relationships with the patients, with your colleagues. It could be a fellow patient advocate, with fellow social worker, whatever it is in the spaces where you work. It promotes acceptance without judgment, establishing safety. You need compassion, all the things where you can build a real relationship. And affiliation doesn't happen after one encounter. You need a number of them. You can get it, and you can have one good relationship and say, I think I'm going to trust that clinician, but it doesn't happen right away. And then close reading is when you view a patient's story and medical history as a novel, you take into account that there's a plot and characters and metaphors, and you consider what the patient omits from their story, what is said and not said. You even take into account what the patient is doing with their body. So in terms of how I use narrative medicine in my advocacy work, I've worked with the Lupus Foundation of America. I'm their Northeast Advocacy Chair. I've worked with the Brooklyn Center for Independence of the Disabled, the Patient Engagement Collaborative that works with the FDA and City. I'm the board chair for the Multicultural Media and Correspondence Association that seeks for diversity across all forms of media. I run narrative medicine workshops in Spanish, and I've presented in Spain and Colombia. I forgot to include my mother's country, Colombia. And I've been fortunate to publish works in narrative medicine in Spain, both articles and chapters. And what I've found is, what narrative medicine has afforded me is, I used to listen with my attorney hat, like ready. I had my answers ready, and I could cut somebody off, and because I listened from a preordained point of view, and I wanted to win. And narrative medicine allows me to listen with a different frame of mind. I'm also able to see, do I want, what is my clinician doing? What is my medical provider doing? Are they not making eye contact, withdrawn? Okay, this is not the doctor for me. But when I'm doing advocacy work, I want to truly collaborate with the person across the aisle. It's been really helpful when I'm doing advocacy work to help pass a bill, things of that nature. So now I really want to get to the meat of what we're going to do together. We're going to look at artwork. We're going to look at a poem together. These are my community requests for you. Please look closely at the images, engage with the material. You can comment in the chat. I'm going to try to look at the chat on the separate computer, or when you're called upon, please comment. Please be patient while they unmute you. I have no control over that. There are no right answers, so please participate. That's the great thing about narrative medicine. We don't have the photographer, we don't have the painter with us. Please be humble and keep an open mind. That's the great thing about narrative medicine. No one is an expert. We're all learning together. And when you're called upon, please share your name because, again, I don't get to see you. So here we go. Normally, narrative medicine, I'll just share this. We're in person. We're in a round table together. And in the Zoom sessions that I run, I get to see you all. So, we're in a bit of a disadvantage, but we're going to do the best we can. So please take a few seconds to look. What do you see? What do you notice? What stands out to you? And if you want to chat with me, please raise your hand so you can be called upon. You can also comment in the chat. Thank you. Hi, Beverly.
Hello, can you hear me?
We can.
This is a picture that, I mean, lots of things jump out at me. And the first thing I saw was the dad playing with his daughter. And I thought, oh, isn't that wonderful? And because it looks like it would be poverty, the roof and the ceiling and the walls. But after our conversation earlier and the speakers before, and I look at the shadow, it is almost frightening because it looks as though the child is hanging. Now, I don't know if anyone else sees that, but that reminds me of how often there are two sides to everything and that everybody sees things differently. But when I see that shadow, it looks like someone is hanging, even though you can't see the rope. You don't necessarily see the father playing with the child.
Thank you, Beverly, for showing attention to that. So I love that you said that. I want to make sure we get to other images, but I'm going to share. Normally, as you know, Beverly, because you've done this with me, I don't share the name until later, but I'm going to share with you the name of this image. It's called, so just for the perspective for everyone, we like to look at an image for a while, normally a half an hour. We like to do sessions for a whole hour. And then we don't share the name of the photographer or the painter or the artist until later after we talk about it for a while. But Beverly called it out. So this is called The House That Bleeds. And I'm going to guess they're referring to this image here. And it's a self-portrait with my daughter and the presence of a hanging man. So that's here, right here. But it was taken in Guerrero, Mexico, which is a state of Mexico where there's a lot of gang violence from the narcotraficantes. And so I really like that you called, right, that your eye was drawn here to family, to care. The child is well dressed, right? She has good clothes, nice shoes, and there's interaction with the family member. But there are a lot of looming other features in the image that you very much called our attention to. Thank you for that, Beverly. Can we have the other person with the raised hand?
Would that be me? It's okay.
Hi, Martha.
Yes, Martha. Thank you. What question do you have for me?
No, I want whatever stands out to you that you want to share with us.
It seems the father and the daughter, I'm assuming it's father and daughter, are sharing joy in spite of the decayed, terrible condition around them. That's what I see.
Thank you for that. Yes, I see that too. And I very much like that the you know, when asked, would you like to take a portrait? This was the way that this parent wanted to take a portrait with their child, right? Yes, so I like that you know, despite the conditions, we're still able to see some joy and some love in this home, despite the, you know, what could be
Environment.
considered deplorable conditions of the home, right?
Right. That's what I
Yes.
see.
Yes, thank you for that. I just want to call out that in the chat, I see haunting, girl looks like she's hanging, certainly in the back. But it's interesting that even though it's a girl, they called it hanging man. The image was called a hanging man. Thank you so much for participating, Martha. I want to share that, so normally after we have talked for a half an hour, we would then write to a writing prompt. And we don't have time to do that because we can't see each other. It's not fair. And I don't have the time to do that. But I want to leave you all with writing prompts. And I'm going to send this all to Ashley and Jamie so that they could share with you. But the writing prompt for this image would be write about a shadow. So again, the writing prompt for this would be write about a shadow. I would give you all 5 minutes to write, no editing. We would stop at 5 minutes, and then whoever wanted to share could share. Again, all of this will be shared as resources later. Okay, so now we're going to move on, and we're going to look at this for a couple of seconds. Some of you, whoever's in New York, may know what this is and where it is. But when you raise your hand, I ask if you could please not say what it is, because as you know, I'm going to share it. Does anybody want to raise their hand and talk with me about this painting?
Hello, my name is Gina, and I'm coming from California. And I see a boat that is overloaded with immigrants. I see the feather that the lady is holding in her hand, and I'm sure that has some significance. I see the people that have been or fell overboard in the water and the attempts to get them back in the boat. I also see the boat as being overcrowded and not sure what's going on the other side, but it doesn't seem like they have enough oars to bring them in. And I don't know how there's a rock or something that the other people are standing on or where that's coming from, but I also assume that the immigrants are charging toward a better life from where they came. That's
Thank
it
you.
for me.
Gina, do you want to do narrative medicine with me? You got it. So Gina, you may, sorry, is there anybody else with is there another raised hand? Okay, thank you for that so much, Gina. I'm going to take the other raised hand.
Okay.
I missed your name.
My name is Wyvonia Woods Harris, and I'm from Memphis, Tennessee. And in
Hi.
this picture, I see these raised hands, and they're so, I think, significant to me as I'm just had my baby sister to die from stage 4 cancer. And one of the things that I made sure that all of my family would say we would raise our hands and say, we are rejoicing anyway. And so even though we know that this is a situation that they're in, as we look at the water that's around them, the fact that there are many of them that with their raised hands and their heads elevated is a point to me of how important it is for us to encourage our seniors, our children, and ourselves to always rejoice anyway, because the situations will stay the same in our mind if we don't have something to point to. So that the pointing hands and the feather are very significant to me. Thank you.
Oh, thank you. First, I'm so sorry for your loss. May they rest in peace. And I love that you drew our attention to that. Some of you may recognize this. It's a deliberate reference to the painting Washington Crossing the Delaware. Emmanuel Lutz's, I'm probably mispronouncing that. When Washington crossed the Delaware, that was painted in 1851. So the Metropolitan Museum of Art commissioned a Canadian artist of Cree ancestry by the name of Kent Monkman to paint this. And it sits right when you come in and you turn, I think it's to the left. And the size is humongous. It's 11 feet by 22 feet. And this artist has painted this woman here. Her name is Miss MISS, Chief, CHIEF. And he has put her in many of his paintings. This is the biggest of them. But yes, as Gina pointed out, the boat is over, it can't fit any more people. But unlike the original painting this is a reimagining, that painting has Washington with soldiers only. And this painting has Indigenous people taking in everybody who needs help. And that pride, proudful hand up with the feathers in them. And then we have soldiers, clear soldiers, and maybe one person, a citizen with a gun in their hand, but they're on a rock. Nobody can get to them, right? And we can all take guesses about what the significance of that. So the writing prompt for this painting is write about a reimagining. Write about a reimagining. And again, you will get all this. Okay, now so I'm going to read this, and then if you all could tell me what you notice, what stands out to you, what resonates with you. This is a poem by Maya Popa. Not the wound, but what the wound implies. Who can say what the tulips dream in a hard frost, the sky as cold as it is clear and still unreadable, or how pain decides what stays in memory, a gift, broken by the time it reaches us, silvered, gleaming with age. So normally the poem would be read twice and by participants, but again, I don't have two people who can read it, so you have to hear my raspy voice. If you can take a look at it, and if somebody wants to share what stands out to you, what are you hearing in the poem? And the great thing, again, you don't have to be a poet or a poetry expert, just what resonates with you. If anybody would like to share their thoughts on the poem, I think you have to raise your hand, just like the way we discussed the artwork. Thank you, Martha.
It reminds me of something terrible happening. And I lost my first baby to malpractice. Then I went on and had 2 more children. And they're like 47 and almost 46 today. And people still talk about how I parented them when they were kids. Anybody that knew them, whether they school, environment, family, that subject still comes up. So you look for the gift in the pain.
Yes, thank you for, well, first, I'm so sorry for your loss. But yes, she's reflecting on how pain and the harsh and if you will, inscrutable, like the unknown, right, of pain, and how even with time, it may change what that pain is like, but yeah, there's still always that memory. And is pain a gift, right? And how
Yeah.
it is changed with time. And then she's referring to that with this silver, right? Gleaming with age, right? But she is asking us almost an unanswerable question, right? Like, who can say what the tulips dream in the hard frost? We don't know that, right? Or how pain decides what stays in memory, right? Then she refers to it as a gift, but it's for us to decide, is it really a gift, right? Which is, to your point, right?
Exactly.
Yeah. Yes, thank you so much. And, even if we look at, in poetry, we look at the title, right? Not the wound, but what the wound implies. And the title of this tells us so much about what we're about to read. But the title itself, we could write something about the title all by itself, right? Thank you for that. Thank you for sharing. Is there anybody else with a raised hand? Thank you.
Yes, I raise my hand as well. Interestingly, my reading of the poem was very similar to Martha's for similar circumstances. We lost our first child when she was a month and a half, almost to the date in November, and had 2 children. One is 50, the other one 53. And as I was reading the poem, the same thought came to me, and the presence of that first child, who died very early in her life, is still represented in our lives as a flower, as a beautiful flower that stayed with us. So she was never gone. She's still there as a flower, in spite of the cold, in spite of the frost. She's still present.
Oh, well, I'm so sorry for your loss. And thank you for sharing. I agree with you that I think, using the metaphors, poets often get to points in a very direct way that often we can't with words or writing an essay. The writing prompt to this is write about a wound. And the video that, unfortunately, I got confused about where it was supposed to start, and my viewing of it seemed like it didn't start. So that's on me. That video, the prompt would have been write a story without words. But again, you're going to get the link, and hopefully you'll be able to view the video. I'm going to share with you, I'm very short on time. This is a painting by Fernando Botero. He's from Colombia, Medellin, Colombia. And everything he drew was oversized figures. Here we see 2 people that are dancing. I know I'm super short on time, but maybe we could have one more person share. What stands out to you about this? And then I promise I will wrap up. I see my countdown. Does anybody want to raise their hand? When I say share, I'm sorry, it means raise your hand. I'm so used to saying share in narrative medicine sessions.
This is why Woods Harris again. I think the one thing I'm seeing is someone that's looking in on the dancers. And I think that, to me, that's how important it is that when we see something, I think there's one of the things they said, we say something. So as we are gathering our thoughts and gathering the purpose for us being on this webinar today, on this program today, I think you said about listening. I have the hearing loss and also vision loss, so I'm peeping into this as the gentleman or the lady that's peeping in through the door, and I know how important that is to us to continue to see something and then say something.
Thank you for sharing that. So I'll quickly say that here we see these oversized dancers, even though this dancer is very short. You notice that there's another person here. I'll make this a little bigger. There's another person here. There's glasses everywhere, but they're oblivious to this bottle. There's cigarette butts. He's about to hit this glass here. And as this dancer is looking at him, but he's looking at this woman here, right? So the writing prompt to this is write about a stolen glance. And then this is by Amy Sherald, who did the portrait for Obama, Michelle Obama. And the title of this is The Fairest of the Not So Fair. And the writing prompt for this one is draw or describe your self-portrait. And the last one is by Inge Schuster, and this is graphic art actually, and it's called A New Morning. And the writing prompt to this is write about being on the brink of the unknown. And I will wrap up with that the more we hone our active listening and close reading skills, the better we get at noticing what comes up for us. Again, for me, is my feeling of my biases, my prejudices. I mean, that's true for all of us, right? What assumptions am I making about the person that I'm doing the work for, or the person that I'm interacting with on the other side of the interaction, right? What can get in the way of our listening? Narrative medicine empowers us through reading and reflecting. It helps us find clarity in our work, and close reading helps us see how we're not alone. It connects us with the text, each other, and the self. And I'll end with sharing from Dr. Sayantani Dasgupta, also part of the narrative medicine faculty. She created the concept of narrative humility. And that is that narrative humility is not about gaining any sense of competence. If we think about cultural competence, right? She completely disagrees with that concept. And she says, narrative humility, we should use that instead. And that it is not about gaining any sense of competence or mastery over our patients or their stories. Rather, it is about paying attention to our own inner workings, our expectations, our prejudices, our own cadre of personal stories that impact how we react to the stories of others. Thank you so much for everybody who participated. And I look forward to you all viewing the video and looking at the other art. And thank you again.